Hip replacements, probably the most successful orthopedic procedure ever, and certainly is a very lucky thing for us because we're able to transform patients' lives with a hip replacement. The happiest patients in my practice are patients that have had a hip replacement.
It so far exceeded my expectations. I had full range of motion, which I had never had my whole entire life. I'm like, I didn't even know my leg could move that way. I could do things. Could go to hike, I could go to a street fair and not be like, where's the nearest bench? I could do an activity all day and then plan an activity at night. I mean, it was just life-changing, absolutely life-changing.
Probably about 60% of my patients fall in the Medicare category. The remainder are young, from all over the spectrum. In fact, I've done hip replacements in teenagers, which sounds a little strange, but it saves a life. It gets the kid back to school, gets the kid back circulating with their friends. Clearly they're not playing football, but there are definite indications. And as I say to my patients often, I don't treat birth certificates, I treat people. And I take the big picture into consideration when recommending something like that. Recovery after hip replacement has dramatically changed, for me at least, in the last year or so, because I'm now doing a small posterior approach to the hip. And most of my patients, certainly the younger ones, leave hospital the next day. It really has been an advance, and it's been brought about by again, sophisticated instruments. So the recovery from a hip replacement can, and usually should be, pretty quick. The incidence of infection in the St. Luke's operating room is the lowest in the city, and I think that's well documented. And that should be the driving factor for anybody considering a big operation. An infection in a hip or a knee replacement is a disaster. Go somewhere where you know you're going to be in the best of circumstances. The second thing is the 8th floor has been made over as an orthopedic unit. All the patients get a private room. The unit is wonderfully staffed. We have a wonderful bunch of nurses on that floor that really perform in a top-class manner. They are empathetic, they are motivated, they're knowledgeable, and I couldn't be more pleased, and I constantly congratulate them, as do the patients. I've been working at St. Luke's now for 30 years and been very happy.